Hi, I am Dr. Felice Gersh, your integrative OBGYN physician. We're going to talk about a hormone that very few people are talking about but should be, especially regarding female health. And I'm going to talk about it in regards to perimenopausal and menopausal women's situations. And another time, I'll talk about it in regards to PCOS. But this is all about not having enough of this vital life hormone, DHEA. So what is DHEA and where is it made? Well, it is primarily, but not exclusively, an adrenal androgen. So androgens are male type hormones, but women have plenty of them. And it turns out that DHEA, which stands for dehydroepiandrosterone, we don't want to say all those words, so we just say DHEA, and its originator in the adrenal, DHEAS, which is I'm going to not say it. DHEAS is the sulfated version of DHEA. DHEAS is an adrenal anabolic androgen as well. It is made exclusively in the adrenal gland. DHEA is made 80% in the adrenal gland and 20% is made in the ovary regarding circulating levels of DHEA. But I want you to know that DHEA can also be made in the gut, like so many hormones. It turns out they can be made as well in the GI tract and also in the brain. It's also known as a neurosteroid. So neuro meaning neurological, it's in the brain. And that's one of its really important attributes is its effects in the brain. Now, with aging, it turns out that the portion of the adrenal gland that makes these really critical androgens, DHEAS and DHEA, it actually starts to shrivel. It gets smaller. You can see it on imaging. And the production is also declining with aging, but not in an absolute predictable way. So you don't know at any age where you are. So you have to measure. You don't know unless you measure it. Now, what should you measure? You want to measure DHEAS because that's telling you what's going on in the adrenal gland. And remember, in circulating levels, it's 80% is coming from the adrenal gland. So you measure DHEAS. Now, what level are you looking for? You want to measure it in blood. I want to repeat, the best way, the most tested way is to measure it in blood. So what level are you looking for? You want it to be around 100. It can be higher than 100. It can be like it can go up to 200, but you want it to be at least 100. Now, you're not looking for it to be above the reference range. That's a different topic. That's androgen excess. That's another story for another day. But if it's much below 100, it is too low. This is a simple blood test. Now, we're talking, once again, DHEAS. So why do we even care about this? Well, DHEAS and DHEA, by the way, are the most abundant steroid hormones that are present in the female body. It outstrips every other steroid hormone. These are really, really important steroids. Now, way back in the day when I was a medical student, I was taught that these steroids were not important as individual steroid hormones. They were precursors to testosterone and ultimately dihydrotestosterone. They were just like precursors. They did nothing. They were not responsible for anything. That is so wrong. We now know they combine to a whole variety of receptors, different types of receptors in a whole host of different tissues, creating really key effects. So these are not like just carriers, waiting to turn into something else. Not at all. These are vital steroid hormones that have really critical effects in the body And with aging, they do tend to decline. So why do we care in terms of, well, what are their effects? Well, if we go through just a few of them, because we're still learning. This is a hormone that hasn't gotten anywhere the attention that it should get. And a lot of the research, by the way, has been done in animals. And you can't assume that what happens in an animal will be the same as a human, but we now have more and more data on humans. Well, for one thing, let's talk about the musculoskeletal system. DHEA, and I'm going to say everything about DHEA. By the way, it applies as well to DHEAS because that's where most, 80% of circulating DHEA comes from, is from the conversion from DHEAS. But when you give the hormone, you do not give DHEAS. If you go to the store, and by the way, I have no idea why this is, but DHEA, which is a really important hormone, is sold as a supplement. Go figure. So you can buy this anywhere, including like on Amazon, and you can buy it without any doctor involvement. That's why I want you to know what you're doing, because you may not have a doctor who's going to be involved in this hormone like dosing or treatment or anything. So, but it's, for whatever reason, it's over the counter. And I prescribe it in my office, but it is over the counter. Now, DHEA is what you prescribe. That's what you take. They don't sell DHEAS. So that's why we're sort of focusing on DHEA. But remember, you measure in the blood DHEAS. Measuring DHEA is not as well studied. And it does involve ovarian function as well, but stay with DHEAS. And once again, you want a level at least 100. Blood test. Now, in terms of the musculoskeletal system, it helps to create new bone and reduces bone loss. It actually works to keep the immune system working properly in the bone. It lowers certain inflammatory cytokines that would trigger the osteoclasts, the specialized immune cells of the bone that gobble up bone, to keep quiet, to not be going crazy and gobbling up bone inappropriately. It also helps stimulate the osteoblasts, the cells in the bone, to create new bone. So this is really important because as women age, over 50% will end up with an osteoporotic fracture. This is no small matter. So we definitely want to think about DHEA as we approach perimenopause and menopause, because you may benefit from going on it if your levels are low. What about muscle? It helps increase the production of muscle. And not the same, but related, is adipose tissue, fat tissue. It's been shown in studies that women who are given DHEA and nothing changes, they're not changing their diet, their exercise, or anything, they lose inches off their waist. They're losing that inflammatory, nobody wants it, belly fat, that visceral fat. This is really important. It helps you burn visceral fat. Now, what does it do to create that? It helps mitochondria, the energy-creating, fat-burning organelles of cells, to work better, to burn fat better. But not just fat, it also helps mitochondria to burn glucose better. So going on DHEA can help regulate glucose metabolism to lower the incidence of diabetes. How fantastic is that? And what about cardiovascular health? It turns out that it is beneficial to the wellness of your cardiovascular system. In fact, there is some data that it lowers all-cause mortality. It lowers your chance of death. It's amazing. And in animals, which I said can't always be, clearly transferred to humans, animals with low levels had a shortened lifespan. But now we feel quite sure that it is beneficial to the lifespan of humans. But of course, we do need more data. And what about fertility? It's used now very commonly to help extend the lifespan and function of ovaries and improve fertility, particularly in perimenopausal women who have declining ovarian function. Now, once again, we definitely need more studies, but this is something very reasonable, and there is a reasonable amount of data, and it's very safe as long as you're dosing it effectively and appropriately, which I'm going to touch on in a moment. Now, what about your immune system? It turns out, I mentioned this in the bone, that it helps to lower certain pro-inflammatory cytokines, those little pro-inflammatory particles that immune cells make. Well, it is really good for the immune system. It increases your protective natural killer cells. It works on your T lymphocytes. So it helps you to have a healthier, more functional immune system. So that is really amazing. Now, I want to touch on in the brain. So if you give it peripherally, like you swallow it or you give it as a cream, it is going to get into the brain. Now, in the brain, it has a beneficial effect with neurotransmitters and other protein, we'll say, communicators, like one which has been very trendy now in terms of research is NMDA. And when you increase it, you actually can reduce bipolar disease, bipolar depression, and generally severe depression. So it's good for the mood. It also can increase GABA, which can help also feeling good, calmer, lowering anxiety, and promote sleep. So very, very great for the bone. And there's also some data that it can help with autoimmune diseases, ulcerative colitis and lupus. And what about sex drive? Well, it turns out that it can increase sexual drive in women and sexual response. It can be given as and there's a prescription version that is both one that's a standard pharmaceutical, or you can get it as a compounded cream. In my practice, I prefer using compounded vaginal DHEA cream. The standard dose I use is 10 milligrams per gram, and I would usually start it by giving a gram. That would be 10 milligrams every night for 2 weeks. That's like a booster dose, like to just start things off. And then I drop it to 2 or 3 times a week that I would dose at 10 milligrams. And there's also a prescription one that you can get that's made by a commercial pharmaceutical company called Intrinsa, which is like a suppository. I just happen to prefer the cream, and I think it absorbs better. I'd like it better. My patients do well on it. The way that it seems to work is that it's converted into estrogen in the lining cells of the vagina, and a little bit will get absorbed, but it's not a lot. So if you really have a low level, you will probably need to take it secondarily as a pill. Usually it's given as a pill, but it can also be made by a compounding pharmacy as a cream, which can be applied to the skin. Talking about skin, the vagina is a type of skin, and there is data that DHEA improves skin in multiple ways to rejuvenate skin, not just vaginal skin, but skin elsewhere. Now, if you're a female, you wouldn't want to put it on your face because it is an androgen, so it might promote hair growth. But it's totally great if you use it as a cream, or of course you can take it as a pill. If you use it as a cream, you can put it on your inner thigh. So if you grow a little extra hair there, it's not a problem at all. But like I said, I usually give the DHEA as a pill, and then I will give the vaginal cream for vaginal rejuvenation, and also it improves, as I mentioned, sex drive and sexual response, which is especially good when you use it intravaginally. So keep that in mind. That you need a prescription for. So you got to get your doctor to prescribe it for you, either as a compounded product or the commercial brand Intrinsa. And there's plenty of published data on that. So you can see the incredible diversity of benefits that accrue to any woman who is low in DHEA. Now, not every woman is low, so you want to check that level. Now, there have been a bunch of questions that came into me about hair loss. So that's why I say check the level. If the level is not low, then don't give it. You don't just give things for no reason. You want to measure and monitor. You want to see after you give it what levels you achieve too. You don't want to overdose anyone. Now, if you are very sensitive and you convert it to testosterone, you can convert DHEA to testosterone. And if you're a woman who has a very active 5-alpha reductase enzyme, you can convert testosterone into its more potent form in the skin and hair follicle into DHT, dihydrotestosterone, which can give you androgenic alopecia. Now, I need you to know, because all the questions I got talked about rapid hair loss. Rapid hair loss is not an androgenic effect. That's called an effluvium. And something else is triggering it. It could be stress, it could be a nutrient insufficiency, but androgenic alopecia is that the hair follicle gets thinner and thinner. The hair growing out of it gets finer and finer, and eventually the hair follicle can literally close over, and then no hair will grow out. So it's a gradual process, not like you use it and suddenly all your hair falls out. You need to evaluate that. Have a doctor evaluate it. That isn't the result of an androgen. There's something else going on. But using an androgen like DHEA in some women can lead to androgenic alopecia or even hirsutism, excessive hair growth, which we don't want. That's why, I always say start low, go slow. So what dose would I start with? I want to tell you because this is over the counter and you may want to self-dose. So I personally recommend my patients start with only 5 milligrams a day. Try it out. See how your body responds. See how you feel. And then after like a month, you can up it to 10 milligrams. See how that goes over another month. And you can keep increasing it every month by 5 milligrams. Once you get to 25, most women stop there. But there is some data that has women go up to even 50 milligrams and even higher. But I don't want you to do that without a supervising physician and having blood levels checked, okay? Because we're not trying to overdose anyone. But if there's no other reason going on that I don't know about, I'm not giving you personal medical advice. I'm just telling you what I normally recommend to my patients. This is not personal advice to you. But I don't want you to self-dose more than 25 milligrams. Please work with a doctor. Women have gone higher in dosing. And people have gone even as high as 75 milligrams with women. And sometimes infertility doctors go higher. But please work with a doctor. But assuming everything is fine and you're feeling well, you have no contraindications, you could consider starting at 5 milligrams, slowly working up to maybe 25. If you start growing hair on your face or you feel like your hair is thinning, then back down. Okay, we're not trying to create problems. And if you can please get your doctor to order a DHEAS level, that would be fantastic. People can even self-order a lot of things. So think about that. I always say measure and monitor when you treat. So DHEA should be on every woman's radar around perimenopause and menopause. So pretty much starting around age 40 and above. This is something important to think about for your cardiovascular health, your musculoskeletal health, your immune health, your skin, your sex drive, all of these and more. I wish we had more data, but we have a reasonable amount to say this is a reasonable approach as part of your healthy aging strategy. Thank you for joining me.